Medical Assistant Exam Injection Questions. Question 1. To protect safety in an infection control audit, the pancreas is discussed during patient education. Which hormone is associated with blood glucose regulation? Option A, melatonin. Option B, estrogen. Option C, insulin. Option D, thyroxine. The correct answer is option C, insulin. Insulin is produced by pancreatic beta cells and helps regulate blood glucose. Melatonin is associated with sleep-wake cycles. Estrogen is a reproductive hormone and is not the main pancreatic glucose hormone. Thyroxine is a thyroid hormone involved in metabolism. Question 2. As part of exam preparation in a preventive care visit, a multi-dose vial has no date after being opened. Which action is most appropriate? Option A, use it because the cap is still attached. Option B, mix it with another vial to avoid waste. Option C, follow facility policy and do not use it if safety cannot be verified. Option D, guess the opening date from memory. The correct answer is option C, follow facility policy and do not use it if safety cannot be verified. Opened multi-dose vials require proper dating and storage to support medication safety. The cap does not prove when the vial was opened or whether it was stored correctly. Combining vials can contaminate medication and is not appropriate. Guessing creates unsafe documentation. Question 3. An office review in a medical office workflow shows that a patient calls with chest pain and shortness of breath. Which scheduling action is most appropriate? Option A, give a diagnosis over the phone. Option B, follow emergency triage protocol immediately. Option C, schedule the patient for next month. Option D, tell the patient to send an email later. The correct answer is option B, follow emergency triage protocol immediately. Potential emergency symptoms should be handled urgently according to office protocol rather than scheduled as routine. Medical assistants should not diagnose the cause of symptoms. Routine scheduling can delay care for potentially serious symptoms. Potential emergencies require immediate action. Question 4. When a patient encounter unfolds in a patient education session, a package of sterile instruments has an expired sterilization date under office policy. Which action is appropriate? Option A, use the instruments if the package is dry. Option B, reprocess the instruments before use. Option C, open the package and rinse the instruments. Option D, write a new date on the package. The correct answer is option B, reprocess the instruments before use. Expired or compromised sterile items should not be used until they are properly reprocessed. A dry package alone does not override an expiration policy. Rinsing does not restore sterility. Changing the date without reprocessing is unsafe and misleading. Question 5. During an administrative check-in area, a subcutaneous injection is ordered. Which site is commonly appropriate? Option A, deep into the deltoid muscle only. Option B, abdomen with adequate subcutaneous tissue. Option C, directly into a vein. Option D, into an area that is bruised and inflamed. The correct answer is option B, abdomen with adequate subcutaneous tissue. Subcutaneous injections are placed into fatty tissue, and the abdomen is a common site when appropriate. The deltoid muscle is an intramuscular site, not a routine subcutaneous site. Intravenous administration is a different route and is outside a subcutaneous injection. Bruised or inflamed tissue should generally be avoided. Question 6. An office review in a women's health clinic shows that the endocrine system is being reviewed. Which gland produces thyroid hormone? Option A, gallbladder. Option B, thyroid gland. Option C, urinary bladder. Option D, appendix. The correct answer is option B, thyroid gland. The thyroid gland produces hormones that help regulate metabolism. The gallbladder stores bile and is not an endocrine gland producing thyroid hormone. The urinary bladder stores urine and does not produce thyroid hormone. The appendix does not produce thyroid hormone. Question 7. Following office protocol in an outpatient laboratory, a medication order is present but the patient reports an allergy to the drug. Which action should occur before administration? Option A, administer the medication because it was ordered. Option B, hold the medication and notify the provider. Option C, ask the patient to sign a form and give it anyway. Option D, change the medication to another drug independently. The correct answer is option B, hold the medication and notify the provider. A reported allergy is a safety concern that must be clarified before giving the medication. An order does not override a possible allergy. A form does not make an unsafe medication appropriate. Medical assistants do not independently substitute medications. Question 8. Following office protocol in a treatment room, a patient reports dizziness when standing and the provider requests orthostatic measurements. Which approach is most appropriate? Option A. Measure blood pressure and pulse in different positions according to protocol. Option B. Have the patient walk quickly before the measurement. Option C. Record the first seated blood pressure as orthostatic. Option D. Measure only oxygen saturation while the patient is seated. The correct answer is option A. Measure blood pressure and pulse in different positions according to protocol. Orthostatic vital signs compare cardiovascular response to position changes. Exertion can distort the readings and increase fall risk. A single seated reading does not show positional change. Oxygen saturation does not assess the blood pressure and pulse changes requested. Question 9. At the start of care in a patient education session, the assistant is checking the electrocardiogram standardization mark. Which setting is commonly expected? Option A, 25 mm per millivolt. Option B, 100 mm per millivolt. Option C, 10 mm per millivolt. Option D, 1 mm per millivolt. The correct answer is option C, 10 mm per millivolt. Standard electrocardiogram calibration is commonly 10 mm per millivolt. That value is not the common standard amplitude calibration. That value would greatly exaggerate waveform size. That calibration would make complexes appear too small for standard interpretation. Question 10. In a diagnostic testing area, a patient makes a complaint about care received in the office. Which response is most professional? Option A, delete documentation related to the complaint. Option B, post the complaint online for staff opinions. Option C, listen respectfully and follow the office complaint process. Option D, argue until the patient stops complaining. The correct answer is option C, listen respectfully and follow the office complaint process. A respectful response and proper reporting support patient relations and quality improvement. Destroying or altering records is unethical and may be illegal. Publicly sharing patient concerns can violate confidentiality. Arguing escalates conflict and is unprofessional. Question 11. Following office protocol in an electronic health record review, the assistant reviews where bile is stored before release into the small intestine. Which organ stores bile? Option A, pancreas. Option B, bladder. Option C, gallbladder. Option D, spleen. The correct answer is option C, gallbladder. The gallbladder stores and concentrates bile made by the liver. The pancreas produces digestive enzymes and hormones but does not store bile. The urinary bladder stores urine, not bile. The spleen is involved in immune and blood cell functions. Question 12. At the start of care in a patient education session, the assistant is exposed to a needle stick from a used needle. Which action should occur first? Option A, wash the area and report the exposure according to protocol. Option B, place a bandage on the site and ignore it. Option C, finish all remaining patients before telling anyone. Option D, hide the incident if there is no bleeding. The correct answer is option A, wash the area and report the exposure according to protocol. Immediate cleansing and prompt reporting start the exposure management process. Covering the wound alone does not address exposure risk. Delaying reporting can delay needed evaluation and follow-up. A needle stick can transmit bloodborne pathogens even with minimal visible injury. Question 13. When a patient encounter unfolds in a pediatric clinic, a mistake is found in an electronic progress note after it was signed. Which correction method is appropriate? Option A, delete the original note completely. Option B, make an addendum according to office policy. Option C, ask a coworker to change it under their login. Option D, ignore the error even if it affects care. The correct answer is option B, make an addendum according to office policy. An addendum preserves the original entry while documenting the correction transparently. Deleting a signed record can destroy the audit trail. Using another person's login violates accountability. Clinically important errors should be corrected through proper procedures. Question 14. Following office protocol in an internal medicine office, a 24-hour urine collection begins at 8 a.m. Which instruction is correct? Option A, collect urine only when symptoms occur. Option B, discard the first void and collect all urine for the next 24 hours. Option C, keep only the first void and discard the rest. Option D, leave the container unrefrigerated unless it smells unusual. The correct answer is option B. Discard the first void and collect all urine for the next 24 hours. Discarding the first void establishes the start time, and all urine afterward is collected until the end time. Timed urine testing requires all urine during the collection period. A single first void is not a 24-hour collection. Storage requirements should follow the test protocol and preservative instructions. Question 15. At the start of care in an exam room, the assistant must clean instruments before sterilization. Which concept explains this requirement? Option A, sterilization is the same as hand washing. Option B, packaging instruments makes cleaning unnecessary. Option C, organic material can interfere with sterilization. Option D, disinfection always destroys every spore. The correct answer is option C. Organic material can interfere with sterilization. Cleaning removes debris so the sterilization process can contact instrument surfaces effectively. Hand washing reduces microbes on skin but is not instrument sterilization. Packaging dirty instruments traps contamination rather than preparing them safely. Disinfection reduces many organisms but does not reliably destroy all spores. Question 16. During a community health clinic, a patient requests an appointment reminder by text message. Which consideration is important? Option A, ignore all reminder preferences. Option B, text any diagnosis to any phone number in the chart. Option C, follow office policy and patient communication preferences. Option D, post the reminder on social media. The correct answer is option C. Follow office policy and patient communication preferences. Electronic reminders should follow privacy policy and documented preferences. Preferences help guide appropriate communication. Sensitive information and wrong numbers can create privacy risk. Public posting would expose private information. Question 17. To protect safety in a quality control review, a patient asks the assistant whether to stop taking a prescribed medication. Which response is appropriate? Option A, suggest using a friend's medication. Option B, refer the question to the provider. Option C, recommend doubling the dose instead. Option D, tell the patient to stop immediately. The correct answer is option B. Refer the question to the provider. Medication changes require provider guidance because stopping therapy can be unsafe. Sharing medication is unsafe and inappropriate. Changing a dose without provider order is unsafe and outside scope. Directing medication discontinuation is outside the assistant role. Question 18. For a patient encounter in a same-day appointment, a chain of custody urine drug screen is collected. Which practice is most important? Option A, use an unlabeled container until the lab receives it. Option B, document each transfer and maintain specimen integrity. Option C, allow the patient to take the specimen home first. Option D, skip signatures if the specimen looks normal. The correct answer is option B. Document each transfer and maintain specimen integrity. Chain of custody documents who handled the specimen from collection through testing. Unlabeled specimens can be rejected and cannot be reliably traced. Uncontrolled possession breaks specimen integrity. Appearance does not replace custody documentation. Question 19. Following office protocol in a clinical skills review, a patient is ready for venipuncture and the labels have already printed. Which identification step should be completed before collecting the specimen? Option A, use the room number because it is faster. Option B, label the tube after returning to the lab. Option C, ask a family member to confirm the name only. Option D, ask the patient to state 2 identifiers and compare them with the order. The correct answer is option D. Ask the patient to state 2 identifiers and compare them with the order. Using 2 approved identifiers before collection helps ensure the right test is performed on the right patient. A room number can change and is not considered a reliable patient identifier. Delayed labeling increases the risk of specimen mix-ups and rejected samples. A family member may be mistaken and 1 identifier is not enough for positive identification. Question 20. When a patient encounter unfolds in a same-day appointment, a prothrombin time test is ordered. Which tube should be selected? Option A, gray tube. Option B, lavender tube. Option C, light blue tube. Option D, a blood culture bottle only. The correct answer is option C, light blue tube. Coagulation tests such as prothrombin time require sodium citrate in a light blue tube. Gray fluorite oxalate is not the standard additive for coagulation studies. Lavender EDTA is used for hematology and can interfere with coagulation testing. Blood cultures detect microorganisms and are not used for prothrombin time testing. Question 21. As part of exam preparation in a pediatric clinic, the assistant prepares a vaccine that must remain refrigerated. Which practice is safest? Option A, place it in direct sunlight to warm quickly. Option B, store it in a desk drawer overnight. Option C, maintain required temperature storage and check expiration before use. Option D, use it after expiration if it looks clear. The correct answer is option C, maintain required temperature storage and check expiration before use. Vaccines and temperature-sensitive medications require proper storage to preserve effectiveness. Sunlight and heat can damage the product. Room temperature storage can damage refrigerated products. Appearance does not prove potency after expiration. Question 22. To protect safety in an exam room, a patient wants information released to a spouse. Which documentation is usually needed? Option A, no documentation because spouses always have full access. Option B, a verbal request from the spouse only. Option C, a note written by the assistant after the fact. Option D, a valid authorization or permission according to office policy. The correct answer is option D, a valid authorization or permission according to office policy. Disclosure to another person should follow privacy rules and documented patient permission. Relationship alone does not automatically grant full access to records. The spouse's request alone may not authorize release. Authorization should come from the patient or legal authority. Question 23. A medical assistant is working in a telephone triage workflow when a waved glucose meter control result is outside the acceptable range. Which action is required before patient testing? Option A, record patient results without documenting controls. Option B, change the patient's diagnosis to match the meter. Option C, resolve the quality control problem according to protocol. Option D, use the meter because patient samples are different. The correct answer is option C, resolve the quality control problem according to protocol. Out-of-range controls mean the system may not be reliable for patient results. Quality control documentation is part of reliable testing. Medical assistants do not diagnose and should not alter clinical information to fit a device. Failed controls must be addressed before reporting patient values. Question 24. To protect safety in a medication administration visit, lead V1 is being placed for a standard 12-lead electrocardiogram. Which location is correct? Option A, 5th intercostal space at the left midclavicular line. Option B, 4th intercostal space at the right sternal border. Option C, left arm below the clavicle. Option D, a 4th intercostal space at the left sternal border. The correct answer is option B, 4th intercostal space at the right sternal border. V1 belongs at the 4th intercostal space on the right side of the sternum. That location corresponds to V4 in standard placement. The left arm electrode is a limb lead site, not V1. That location corresponds to V2. Question 25. For a patient encounter in a medical office workflow, the provider asks for an instrument to examine the ear canal. Which instrument should be prepared? Option A, ophthalmoscope. Option B, spirometer. Option C, otoscope. Option D, speculum for pelvic exam. The correct answer is option C, otoscope. An otoscope is used to inspect the ear canal and tympanic membrane. An ophthalmoscope is used to examine internal eye structures. A spirometer evaluates lung function rather than the ear. A vaginal speculum is not used to inspect the ear canal. Question 26. Before the visit continues in a clinical skills review, a pelvic examination is scheduled. Which patient position is commonly used? Option A, Trendelenburg. Option B, a prone. Option C, lithotomy. Option D, Sims. The correct answer is option C, lithotomy. The lithotomy position is commonly used for pelvic examinations. Trendelenburg places the head lower than the feet and is not the routine pelvic exam position. Prone means lying face down and is not the common pelvic exam position. Sims position is often used for rectal procedures or enemas. Question 27. For a patient encounter in an urgent care office, the assistant prepares instruments for suture removal. Which item is commonly needed? Option A, tuning fork only. Option B, peak flow meter only. Option C, ophthalmoscope only. Option D, suture removal scissors or sterile scissors according to policy. The correct answer is option D, suture removal scissors or sterile scissors according to policy. Suture removal requires an appropriate cutting instrument and aseptic supplies according to the procedure. A tuning fork may be used in hearing or vibration tests. A peak flow meter measures expiratory airflow and does not remove sutures. An ophthalmoscope is used to examine the eye, not remove sutures. Question 28. Before the visit continues in a medication administration visit, a new patient calls to schedule an annual physical. Which information should be collected for registration? Option A, only the patient's favorite pharmacy color. Option B, demographics, contact information, insurance information, and reason for visit. Option C, the assistant's diagnosis before the visit. Option D, another patient's insurance card. The correct answer is option B, demographics, contact information, insurance information, and reason for visit. Complete registration information supports scheduling, billing, and clinical preparation. That information does not complete registration. The assistant should not diagnose during scheduling. Insurance information must belong to the patient being registered. Question 29. For a patient encounter in a medication administration visit, a sterile dressing change is being prepared. Which action helps maintain sterility? Option A, place sterile gauze on an unclean counter. Option B, reuse sterile gloves from a previous patient. Option C, reach across the field with unsterile clothing. Option D, open sterile supplies without touching the inner sterile surface. The correct answer is option D, open sterile supplies without touching the inner sterile surface. Avoiding contact with sterile surfaces helps preserve the sterile field. An unclean surface contaminates sterile supplies. Sterile gloves are single-use and patient-specific. Reaching over the field can contaminate it. Question 30. During an administrative check-in area, a provider needs the head of the exam table raised for a patient with breathing difficulty. Which position may be helpful? Option A, prone position. Option B, lithotomy position. Option C, Trendelenburg as the only routine choice. Option D, Fowler position. The correct answer is option D, Fowler position. Fowler position raises the head and upper body, which can ease breathing for some patients. Prone places the patient face down and may worsen breathing comfort. Lithotomy is used for pelvic procedures and does not primarily support breathing. Trendelenburg lowers the head and is not the usual comfort position for breathing difficulty. Question 31. Given the workflow in a phlebotomy station, a laboratory result is critical and the protocol requires immediate notification. Which action should the assistant take? Option A, discard the result because it is abnormal. Option B, file the result for review at the end of the month. Option C, tell the patient the exact diagnosis without provider review. Option D, notify the provider or designated clinical staff promptly. The correct answer is option D, notify the provider or designated clinical staff promptly. Critical results require rapid communication so the care team can respond. Abnormal results must be reported, not discarded. Delaying a critical result can put the patient at risk. Diagnosis and interpretation belong to the provider. Question 32. A medical assistant is working in an internal medicine office when a patient asks which body system includes the skin. Which system should be identified? Option A, endocrine system. Option B, urinary system. Option C, respiratory system. Option D, integumentary system. The correct answer is option D, integumentary system. The integumentary system includes the skin, hair, nails, and related glands. The endocrine system is made of hormone-producing glands. The urinary system filters blood and eliminates urine. The respiratory system supports breathing and gas exchange. Question 33. An office review in a cardiology practice shows that a tourniquet has been in place for more than 1 minute before venipuncture. Which action is safest? Option A, move it over the venipuncture site. Option B, tighten it further until the vein bulges. Option C, release it and allow the arm to recover before continuing. Option D. Ignore the time because tourniquets do not affect tests. The correct answer is option C. Release it and allow the arm to recover before continuing. Prolonged tourniquet time can cause hemoconcentration and affect test results. A tourniquet is placed above the site, not over the puncture area. More pressure can increase discomfort and alter specimen quality. Tourniquet time can affect certain laboratory values. Question 34. A medical assistant is working in an internal medicine office when a 12-lead electrocardiogram shows wandering baseline artifact. Which cause is most likely? Option A. Correct limb lead placement. Option B. A normal calibration mark only. Option C. A properly grounded machine with still patient. Option D. Poor electrode contact or patient movement. The correct answer is option D. Poor electrode contact or patient movement. Wandering baseline is commonly caused by motion, loose electrodes, or poor skin contact. Correct placement should reduce rather than create artifact. Calibration marks do not explain baseline movement during tracing. Good grounding and stillness reduce electrical or motion artifact. Question 35. An office review in a community health clinic shows that a provider documents a vaccine administration. Which coding information may be needed for billing? Option A. Only the room number. Option B. Procedure code and diagnosis or reason for the service. Option C. Only the assistant's initials with no service information. Option D. Only the patient's favorite color. The correct answer is option B. Procedure code and diagnosis or reason for the service. Claims often require a service code and a diagnosis or reason to support medical necessity. Room numbers do not describe the service or diagnosis. Initials alone do not provide billing codes or medical necessity. Personal preferences do not support claim coding. Question 36. The care team in a treatment room asks for guidance because a provider orders a medication using an abbreviation on the unsafe abbreviation list. Which action should the medical assistant take? Option A. Ignore the medication order completely without communication. Option B. Interpret the abbreviation however it seems most likely. Option C. Clarify the order before proceeding. Option D. Ask another patient what the abbreviation means. The correct answer is option C. Clarify the order before proceeding. Unsafe or unclear medication orders must be clarified to prevent misinterpretation. The order should be clarified rather than silently ignored. Guessing can lead to serious medication errors. Patients are not appropriate sources for interpreting orders. Question 37. Before the visit continues in a treatment room, the assistant reviews the path of blood leaving the right ventricle. Which vessel receives it? Option A. Superior vena cava. Option B. Pulmonary vein. Option C. Aorta. Option D. Pulmonary artery. The correct answer is option D. Pulmonary artery. The pulmonary artery carries deoxygenated blood from the right ventricle to the lungs. The superior vena cava returns venous blood to the right atrium. Pulmonary veins return oxygenated blood from the lungs to the left atrium. The aorta carries oxygenated blood from the left ventricle to the body. Question 38. Given the workflow in a same-day appointment, a patient pays a fixed amount at the time of an office visit. Which insurance term applies? Option A. Deductible. Option B. Premium. Option C. Copayment. Option D. Adjustment. The correct answer is option C. Copayment. A copayment is a fixed amount the patient pays for a covered service. A deductible is the amount the patient pays before insurance begins paying according to the plan. A premium is the amount paid to maintain insurance coverage. An adjustment changes the billed amount based on contracts or corrections. Question 39. Before the visit continues in a preventive care visit, the suffix ectomy appears in a procedure term. Which meaning is most accurate? Option A. Inflammation. Option B. Surgical removal. Option C. Visual examination. Option D. Abnormal softening. The correct answer is option B. Surgical removal. Ectomy means surgical removal of a structure. Inflammation is indicated by itis. Visual examination is often indicated by scopy. Abnormal softening is indicated by malacia. Question 40. When a patient encounter unfolds in a women's health clinic, a patient appears to be choking but can cough forcefully. Which response is generally appropriate? Option A. Encourage coughing and monitor closely. Option B. Perform blind finger sweeps immediately. Option C, leave the patient alone until they stop coughing. Option D, give the patient food to push it down. The correct answer is option A. Encourage coughing and monitor closely. A forceful cough suggests partial airway obstruction, and coughing may clear it. Blind finger sweeps can push the object deeper and are not appropriate. The patient should be monitored because the obstruction may worsen. Food can worsen the obstruction. Question 41. For a patient encounter in a busy front office, a patient is scheduled for an electrocardiogram and asks whether it will shock them. Which response is accurate? Option A. The test records electrical activity and does not deliver a shock. Option B. The electrodes inject medication. Option C. The machine draws blood through the wires. Option D. The test shocks every patient to start the heart. The correct answer is option A. The test records electrical activity and does not deliver a shock. A standard electrocardiogram is a recording test, not a treatment shock. Electrodes record signals and do not inject medication. Electrocardiogram leads do not collect blood. A standard electrocardiogram does not deliver electrical therapy. Question 42. In a busy front office, a used needle must be discarded after an injection. Which practice is safest? Option A. Place the needle in regular trash. Option B. Activate the safety device and place the needle in a sharps container. Option C. Recap the needle with both hands. Option D. Carry the needle to the front desk for disposal. The correct answer is option B. Activate the safety device and place the needle in a sharps container. Sharps should be secured and discarded immediately in a puncture-resistant sharps container. Sharps can injure staff and must not go into regular trash. Two-handed recapping increases needle stick risk. Transporting exposed sharps through the office increases risk. Question 43. The care team in a treatment room asks for guidance because the assistant teaches a patient how to prepare for a fasting laboratory test. Which method best confirms understanding? Option A. Give instructions as quickly as possible. Option B. Ask the patient to explain the instructions back in their own words. Option C. Ask only whether the patient has any questions. Option D. Use medical jargon to sound professional. The correct answer is option B. Ask the patient to explain the instructions back in their own words. Teach back checks whether the patient understood the instructions and allows correction of misunderstandings. Rushing can reduce comprehension. Patients may say no even when they misunderstand instructions. Jargon can confuse patients and reduce understanding. Question 44. When a patient encounter unfolds in a clinical skills review, an intradermal test is being prepared. Which description matches the route? Option A. Injection into deep muscle tissue. Option B. Medication placed into the ear canal. Option C. Injection just under the epidermis to form a small wheal. Option D. Medication swallowed by mouth. The correct answer is option C. Injection just under the epidermis to form a small wheal. Intradermal injections are shallow and often create a small bleb or wheal. Deep muscle injection is intramuscular. Ear canal administration is otic. Swallowed medication is oral administration. Question 45. After reviewing the situation in a primary care office, a patient becomes angry about a long wait time. Which response is most appropriate? Option A. Ignore the patient until the appointment starts. Option B. Tell the patient to calm down or leave. Option C. Acknowledge the frustration and provide a realistic update. Option D. Blame the provider in front of the patient. The correct answer is option C. Acknowledge the frustration and provide a realistic update. Empathy and accurate information can de-escalate frustration while maintaining professionalism. Ignoring frustration often makes the situation worse. Commands can escalate conflict and harm patient rapport. Blaming coworkers is unprofessional and does not solve the issue. Question 46. After reviewing the situation in an outpatient laboratory, a pain score is being collected during intake. Which approach is best? Option A. Assume pain level from facial expression only. Option B. Change the score to match the assistant's opinion. Option C. Ask the patient to rate pain using the office's standard scale. Option D. Tell the patient pain is not part of vital signs. The correct answer is option C. Ask the patient to rate pain using the office's standard scale. Using a consistent pain scale helps document subjective pain in a comparable way. Facial expression alone may not reflect the patient's reported pain. The pain score should reflect the patient's report. Pain assessment is commonly included in intake workflows. Question 47. During a primary care office, a patient asks why a medication is placed under the tongue. Which route is being described? Option A, ophthalmic. Option B, otic. Option C, topical. Option D, sublingual. The correct answer is option D, sublingual. Sublingual administration places medication under the tongue for absorption through oral mucosa. Ophthalmic medications are used in the eye. Otic medications are placed in the ear. Topical medications are applied to the skin or surface tissues. Question 48. Before the visit continues in a family practice clinic, a tickler file is used in the office. Which purpose does it serve? Option A, sterilize instruments. Option B, track future follow-ups or reminders. Option C, draw blood into tubes. Option D, measure oxygen saturation. The correct answer is option B, track future follow-ups or reminders. A tickler system helps staff remember time-sensitive tasks or future actions. Sterilization requires approved equipment and process. Blood collection uses phlebotomy supplies, not a reminder file. Oxygen saturation requires a pulse oximeter. Question 49. In a patient education session, an order reads amoxicillin 500 mg by mouth. Which abbreviation matches the route? Option A, 4. Option B, PA. Option C, IM. Option D, subcut. The correct answer is option B, PA. PA means by mouth and is used for oral administration. 4 means intravenous and refers to administration into a vein. IM means intramuscular and refers to injection into muscle. Subcut means subcutaneous and refers to injection into tissue under the skin. Question 50. Before the visit continues in a patient intake station, the office schedules several patients at the start of each hour and sees them as rooms open. Which scheduling method is being used? Option A, stream scheduling. Option B, prior authorization. Option C, wave scheduling. Option D, matrix blocking. The correct answer is option C, wave scheduling. Wave scheduling brings patients in at set intervals such as the start of an hour. Stream scheduling assigns patients specific individual appointment times. Prior authorization is payer approval and is not a scheduling method. Matrix blocking reserves time unavailable for patient appointments. Question 51. When a patient encounter unfolds in a medication administration visit, the QRS complex is reviewed on an electrocardiogram. Which event does it mainly represent? Option A, lung gas exchange. Option B, atrial repolarization only as the visible main event. Option C, ventricular depolarization. Option D, ventricular filling with blood only. The correct answer is option C, ventricular depolarization. The QRS complex represents electrical activation of the ventricles. Gas exchange occurs in the alveoli, not on the QRS waveform. Atrial repolarization is usually hidden within the QRS complex. Mechanical filling is not the primary electrical event represented by QRS. Question 52. In a telephone triage workflow, the assistant prepares the room for a minor sterile procedure. Which action supports patient dignity? Option A, discuss the patient's body in the hallway. Option B, leave the patient uncovered until the provider arrives. Option C, skip explanations because the patient signed in. Option D, provide appropriate draping and expose only the area being examined. The correct answer is option D, provide appropriate draping and expose only the area being examined. Draping preserves privacy and warmth while allowing the provider access to the needed area. Public discussion can violate privacy and professionalism. Unnecessary exposure reduces dignity and comfort. Patients still need respectful communication during preparation. Question 53. During a primary care office, a patient asks for printed medication instructions. Which practice improves health literacy? Option A, use only complex medical terminology. Option B, tell the patient to search online without guidance. Option C, provide instructions in the wrong language. Option D, use clear language and review the key points with the patient. The correct answer is option D, use clear language and review the key points with the patient. Plain language and review help patients understand and follow instructions. Complex terms can reduce comprehension. Unguided online searching may provide inaccurate or confusing information. Language mismatch can prevent safe understanding. Question 54. While working in a preventive care visit, a patient arrives at check-in and the waiting room can overhear the conversation. Which practice protects privacy? Option A. Speak quietly and avoid announcing sensitive details. Option B. State the full diagnosis loudly to confirm the visit. Option C. Ask other patients to help verify the record. Option D. Place all charts open on the counter. The correct answer is option A. Speak quietly and avoid announcing sensitive details. Front office privacy requires limiting unnecessary disclosure where others may overhear. Announcing diagnoses in public can violate confidentiality. Other patients should not be involved in private verification. Open charts may expose protected information. Question 55. Before the visit continues in a diagnostic testing area, a provider orders spirometry in the office. Which patient action is required? Option A. Talk continuously during the maneuver. Option B. Remove the mouthpiece before starting. Option C. Hold both nostrils and refuse to exhale. Option D. Follow instructions for a strong, complete breathing maneuver. The correct answer is option D. Follow instructions for a strong, complete breathing maneuver. Spirometry requires patient effort and correct technique to produce useful results. Talking interferes with airflow measurement. The mouthpiece is needed to measure airflow. The test depends on controlled breathing through the device. Question 56. When a patient encounter unfolds in a clinical skills review, multiple venipuncture tubes are ordered after blood cultures. Which tube should usually come next in the order of draw? Option A. Light blue sodium citrate tube. Option B. Gray fluoride oxalate tube. Option C. Lavender EDTA tube. Option D. Green heparin tube. The correct answer is option A. Light blue sodium citrate tube. After blood cultures, the light blue citrate tube is typically collected early to protect coagulation testing accuracy. Gray tubes are generally collected near the end of the order. EDTA tubes are collected later because the additive can contaminate other tubes. Green tubes usually follow serum tubes and do not come immediately after blood cultures in the standard sequence. Question 57. An office review in a quality control review shows that a medical assistant prepares to administer an injection. Which set best represents medication rights? Option A. Right patient, right medication, right dose, right route, right time, and right documentation. Option B. Right diagnosis only. Option C. Right color of vial and right storage shelf. Option D. Right insurance, right copay, right appointment, and right room. The correct answer is option A. Right patient, right medication, right dose, right route, right time, and right documentation. The medication rights are safety checks used to prevent administration errors. Diagnosis alone is not enough to confirm safe administration. Vial appearance and shelf location are not sufficient medication rights. Administrative details do not replace medication safety checks. Question 58. When a patient encounter unfolds in an internal medicine office, a medical assistant performs a procedure without patient permission. Which legal concern may apply? Option A. Defamation. Option B. Battery. Option C. Coordination of benefits. Option D. Emancipation. The correct answer is option B. Battery. Battery can involve intentional touching or treatment without consent. Defamation involves false statements that harm reputation. Coordination of benefits is an insurance concept. Emancipation relates to a minor's legal independence. Question 59. For a patient encounter in a quality control review, the term cardiology appears in a referral. Which specialty is involved? Option A. Digestive disorders. Option B. Heart and cardiovascular system. Option C. Skin disorders. Option D. Kidney disorders. The correct answer is option B. Heart and cardiovascular system. Cardiology focuses on the heart and cardiovascular system. Gastroenterology focuses on the digestive system. Dermatology focuses on the skin. Nephrology focuses on the kidneys. Question 60. To protect safety in a certification exam scenario, a minor arrives without a parent for a non-urgent visit. Which action is best? Option A. Refuse all care without considering exceptions. Option B. Assume all minors can consent to every service. Option C. Ask another patient in the waiting room to consent. Option D. Follow state law and office policy for consent requirements. The correct answer is option D. Follow state law and office policy for consent requirements. Consent rules for minors vary by situation and jurisdiction, so policy must be followed. Some laws allow minors to consent for certain services. Minor consent is not universal for all services. Other patients cannot provide consent for the minor. Question 61. As part of exam preparation in a certification exam scenario, blood flow stops during a venipuncture after the tube begins filling. Which action is most appropriate? Option A. Gently adjust the needle position while maintaining safety. Option B. Remove the tourniquet and continue filling all tubes. Option C. Probe aggressively until blood returns. Option D. Label the empty tube as collected. The correct answer is option A. Gently adjust the needle position while maintaining safety. A small adjustment may restore blood flow if the bevel is against the vein wall. Without blood flow, the collection cannot continue effectively. Excessive probing can injure tissue and increase patient discomfort. A tube without the required specimen must not be labeled as completed. Question 62. For a patient encounter in an electronic health record review, a patient questions a medication that looks different from the usual dose. Which response is safest? Option A. Tell the patient that questions are not allowed. Option B. Document that the patient was difficult and continue. Option C. Give the medication quickly before the patient refuses. Option D. Pause administration and verify the order and medication. The correct answer is option D. Pause administration and verify the order and medication. A patient concern can identify a potential medication error, so verification is required before proceeding. Patients should be encouraged to participate in safety. Labeling the patient does not resolve the possible medication issue. Rushing increases risk and ignores a safety concern. Question 63. Following office protocol in a phlebotomy station, a medical assistant is preparing a sterile field. Which action would contaminate the field? Option A. Using sterile forceps for sterile supplies. Option B. Keeping sterile items above waist level. Option C. Reaching across the sterile field with an unsterile sleeve. Option D. Opening the wrapper away from the body first. The correct answer is option C. Reaching across the sterile field with an unsterile sleeve. Crossing a sterile field with unsterile clothing can contaminate the field. Sterile forceps can help maintain asepsis when used correctly. Sterile items are generally kept in view and above waist level. Opening the far flap first is a common way to avoid reaching over the field. Question 64. Given the workflow in a primary care office, an electronic record uses an audit trail. What is its purpose? Option A. Approve insurance claims instantly. Option B. Measure blood pressure. Option C. Sterilize instruments automatically. Option D. Track who accessed or changed information. The correct answer is option D. Track who accessed or changed information. Audit trails support accountability by recording user activity in the record. Payer claims processing is separate from record audit logs. Vital sign measurement requires clinical equipment and technique. Audit trails do not process instruments. Question 65. Before the visit continues in a quality control review, the term gastroenterology appears in a referral. Which specialty is involved? Option A. Endocrine glands. Option B. Urinary bladder only. Option C. Nervous system. Option D. Digestive system. The correct answer is option D. Digestive system. Gastroenterology focuses on the digestive tract and related disorders. Endocrinology focuses on hormone-producing glands. Urology focuses on the urinary tract and male reproductive system. Neurology focuses on the nervous system. Question 66. As part of exam preparation in a cardiology practice, a patient says they feel chest pressure while the electrocardiogram is being prepared. Which action should the medical assistant take? Option A. Tell the patient it is probably anxiety. Option B. Complete all paperwork before telling anyone. Option C. Ask the patient to drive to another clinic. Option D. Notify the provider immediately and follow emergency protocol. The correct answer is option D. Notify the provider immediately and follow emergency protocol. Chest pressure may indicate a serious condition and requires prompt clinical attention. Medical assistants should not diagnose the cause of chest pressure. Administrative tasks should not delay reporting possible cardiac symptoms. Potential cardiac symptoms should be handled through established emergency procedures. Question 67. An office review in a preventive care visit shows that a patient feels faint during a blood draw. Which response should occur first? Option A. Leave the patient alone to find paperwork. Option B. Stop the procedure and protect the patient from injury. Option C. Finish filling the tube before responding. Option D. Tell the patient to stand up quickly. The correct answer is option B. Stop the procedure and protect the patient from injury. Safety comes first when a patient shows signs of syncope during venipuncture. A faint patient should not be left unattended. Continuing the draw can worsen the situation and increase injury risk. Standing can worsen faintness and lead to a fall. Question 68. While working in a clinical skills review, the assistant is reviewing the function of red blood cells. Which role is most accurate? Option A. Create antibodies as their main role. Option B. Filter lymph. Option C. Transport oxygen. Option D. Produce bile. The correct answer is option C. Transport oxygen. Red blood cells contain hemoglobin, which carries oxygen to tissues. Antibody production is associated with certain white blood cells and plasma cells. Lymph nodes filter lymph rather than red blood cells producing this function. Bile is produced by the liver and stored in the gallbladder. Question 69. After reviewing the situation in an urgent care office, the P wave is reviewed on an electrocardiogram. Which event does it represent? Option A. Kidney filtration. Option B. Atrial depolarization. Option C. Ventricular repolarization. Option D. Ventricular depolarization. The correct answer is option B. Atrial depolarization. The P wave represents electrical activation of the atria. Kidney filtration is unrelated to electrocardiogram waveforms. Ventricular repolarization is represented by the T wave. Ventricular depolarization is represented mainly by the QRS complex. Question 70. The care team in a pediatric clinic asks for guidance because a patient has a red allergy band on the wrist. Which action should occur before medication administration? Option A. Give medication first and ask about allergies later. Option B. Ignore the band if the patient seems healthy. Option C. Verify the allergy information in the record and with the patient. Option D. Remove the band so it does not worry the patient. The correct answer is option C. Verify the allergy information in the record and with the patient. Allergy alerts must be checked before medication administration to prevent reactions. Allergies must be checked before administration. Allergy risk is not based on appearance. Removing an alert without direction can create risk. Question 71. A medical assistant is working in an infection control audit when a vial contains 100 mg per milliliter and the order is 50 mg. Which volume should be prepared? Option A. 5 milliliters. Option B. 1 milliliter. Option C. 0.5 milliliter. Option D. 10 milliliters. The correct answer is option C. 0.5 milliliter. Dividing the ordered dose by the available concentration gives 50 divided by 100, which equals 0.5 milliliter. 5 milliliters would provide 500 milligrams at this concentration. 1 milliliter would provide 100 milligrams. 10 milliliters would provide 1000 milligrams and is far above the ordered dose. Question 72. In a patient intake station, the office wants to place 2 short follow-up visits in the same time slot according to policy. Which scheduling method is being used? Option A. Wave scheduling. Option B. Clustering. Option C. Double booking. Option D. Open hours. The correct answer is option C. Double booking. Double booking places more than one patient in the same appointment slot. Wave scheduling schedules several patients to arrive at the beginning of a block. Clustering groups similar types of appointments together. Open hours allow patients to arrive without exact appointment times. Question 73. To protect safety in an exam room, a medication is labeled for otic use. Where should it be administered? Option A. Eye. Option B. Mouth. Option C. Nose. Option D. Ear. The correct answer is option D. Ear. Otic medications are intended for the ear. Eye medications are ophthalmic, not otic. Oral medications are taken by mouth. Nasal medications are administered through the nose. Question 74. For a patient encounter in a procedure setup, the provider asks the assistant to prepare for a visual acuity test. Which tool is commonly used? Option A. Tourniquet. Option B. Snellen chart. Option C, autoclave tape. Option D, hemostat. The correct answer is option B, Snellen chart. A Snellen chart is used to screen distance visual acuity. A tourniquet helps locate veins for blood collection. Autoclave tape indicates exposure to sterilization conditions. A hemostat clamps tissue or small objects during procedures. Question 75. When a patient encounter unfolds in a quality control review, a specimen must be protected from light after collection. Which handling method is appropriate? Option A, leave the specimen uncovered at the front desk. Option B, shake the specimen vigorously for 1 minute. Option C, place the tube in direct sunlight to warm it. Option D, wrap the specimen in foil or use an amber container as directed. The correct answer is option D. Wrap the specimen in foil or use an amber container as directed. Some analytes are light sensitive and require protection immediately after collection. Delayed or improper handling can compromise results. Vigorous shaking can hemolyze blood specimens. Sunlight can degrade light-sensitive specimens. Question 76. As part of exam preparation in a preventive care visit, a patient states that the listed pharmacy is no longer used. Which action best supports accurate care coordination? Option A, leave the old pharmacy because it is already in the chart. Option B, choose the pharmacy closest to the clinic. Option C, update the preferred pharmacy after verifying the new information. Option D, delete all pharmacy information from the record. The correct answer is option C, update the preferred pharmacy after verifying the new information. Current pharmacy information helps prescriptions and refills reach the correct location. Outdated demographic information can delay medication access. The preferred pharmacy should come from the patient rather than staff convenience. Removing needed information can interrupt prescribing workflows. Question 77. For a patient encounter in a quality control review, a medical assistant discusses a patient's diagnosis in a crowded elevator. Which rule is being violated? Option A, prior authorization. Option B, sterile technique. Option C, patient confidentiality. Option D, chain of custody. The correct answer is option C, patient confidentiality. Discussing identifiable health information in a public area can expose confidential information. Prior authorization concerns payer approval for services. Sterile technique concerns preventing contamination during procedures. Chain of custody concerns specimen handling documentation, not public conversations. Question 78. During a certification exam scenario, the medical assistant takes a phone message for the provider. Which information is most important to include? Option A, a promise that medication will be prescribed. Option B, the assistant's guess about the diagnosis. Option C, only the caller's first name. Option D, caller identity, contact information, reason for call, and urgency. The correct answer is option D, caller identity, contact information, reason for call, and urgency. Complete phone messages help the provider triage and respond appropriately. Medication decisions belong to the provider. Diagnosis should not be guessed in a phone message. A first name alone may not identify the patient or issue. Question 79. While working in an urgent care office, the provider asks for an instrument to examine the retina. Which instrument should be prepared? Option A, centrifuge. Option B, reflex hammer. Option C, otoscope. Option D, ophthalmoscope. The correct answer is option D, ophthalmoscope. An ophthalmoscope is used to view internal eye structures such as the retina. A centrifuge separates specimen components and is not an eye exam tool. A reflex hammer tests reflexes and does not visualize the retina. An otoscope is used for the ear canal and tympanic membrane. Question 80. An office review in a certification exam scenario shows that the provider asks the assistant to perform a task prohibited by state law. Which action is appropriate? Option A, document that the patient requested it and proceed. Option B, clarify the concern and follow legal scope of practice requirements. Option C, perform it because any provider request is automatically legal. Option D, ask another assistant to do it secretly. The correct answer is option B, clarify the concern and follow legal scope of practice requirements. Medical assistants must follow laws, regulations, and employer policy even when working under delegation. Patient request does not override scope of practice limits. Delegation does not make a prohibited task legal. Passing on an improper task does not resolve the legal issue. Question 81. While working in a medical office workflow, the assistant removes soiled dressings from a wound. Which practice is appropriate? Option A. Use gloves and dispose of the dressing according to biohazard policy. Option B. Save the dressing in the patient's purse. Option C. Handle the dressing with bare hands. Option D. Place the dressing on the clean supply tray. The correct answer is option A. Use gloves and dispose of the dressing according to biohazard policy. Soiled dressings can contain blood or body fluids and require barrier protection and proper disposal. Biohazard waste should not be sent home in personal belongings. Bare hand contact increases exposure risk. Soiled material can contaminate clean supplies. Question 82. After reviewing the situation in a pediatric clinic, a peak flow test is ordered. Which body system is being assessed? Option A. Urinary system. Option B. Skeletal system only. Option C. Respiratory system. Option D. Integumentary system. The correct answer is option C. Respiratory system. Peak flow measures how quickly air can be exhaled and is related to respiratory function. The urinary system is assessed with urine tests and related procedures. Peak flow does not measure bone structure. The integumentary system involves the skin, hair, and nails. Question 83. In a family practice clinic, the suffix itis appears in a medical term. Which meaning is most accurate? Option A. Pain. Option B. Study of. Option C. Removal. Option D. Inflammation. The correct answer is option D. Inflammation. The suffix itis generally means inflammation. Pain is commonly indicated by the suffix algia. Study of is commonly indicated by the suffix logi. Removal is commonly indicated by the suffix ectomy. Question 84. As part of exam preparation in a diagnostic testing area, a sterile package is torn before a minor procedure. Which action is required? Option A. Tape the wrapper and use the contents. Option B. Use the items if they look clean. Option C. Consider the contents contaminated and obtain a new sterile package. Option D. Spray the package with disinfectant. The correct answer is option C. Consider the contents contaminated and obtain a new sterile package. A torn wrapper breaks the sterile barrier, so the contents cannot be considered sterile. Taping does not restore sterility after the barrier is compromised. Clean appearance does not prove sterility. Surface disinfectant cannot sterilize items inside a compromised package. Question 85. For a patient encounter in an administrative check-in area, an intramuscular injection is ordered for an adult. Which site may be used according to protocol? Option A. The fingernail bed. Option B. Deltoid muscle when the medication and volume are appropriate. Option C. A reddened rash site. Option D. Inside a visible vein. The correct answer is option B. Deltoid muscle when the medication and volume are appropriate. The deltoid can be used for certain adult intramuscular injections when volume and medication are suitable. The fingernail bed is not an intramuscular injection site. Irritated or infected skin should generally be avoided. A vein is used for intravenous access, not intramuscular injection. Question 86. A medical assistant is working in an internal medicine office when a mask becomes wet during patient care. Which action is appropriate? Option A. Keep wearing it for the rest of the week. Option B. Replace the mask according to infection control practice. Option C. Dry it on the clean supply shelf. Option D. Share it with a coworker. The correct answer is option B. Replace the mask according to infection control practice. A wet mask is less effective and should be changed safely. Extended use of a wet mask is not appropriate. Used masks can contaminate clean areas. Masks are not shared between staff. Question 87. Before the visit continues in a busy front office, the assistant documents a patient's statement in the medical record. Which entry is most appropriate? Option A. The assistant diagnoses pneumonia. Option B. Patient is definitely exaggerating the cough. Option C. No documentation is needed for symptoms. Option D. Patient states, I have had a cough for 3 days. The correct answer is option D. Patient states, I have had a cough for 3 days. Quoting or clearly attributing patient statements helps distinguish subjective information from clinical findings. Diagnosis belongs to the provider. Judgmental wording is inappropriate and not objective. Symptoms are relevant to the visit and should be documented according to policy. Question 88. While working in a specialty referral visit, the assistant uses a fire extinguisher on a small contained fire. Which acronym describes extinguisher use? Option A, PASS. Option B, ARICE. Option C, PERLA. Option D, HIPAA. The correct answer is option A, PASS. PASS stands for pull, aim, squeeze, and sweep. RICE refers to rest, ice, compression, and elevation for certain injuries. PERLA describes pupil assessment. HIPAA governs health information privacy and security. Question 89. In a specialty referral visit, a patient is placed lying face down for a back examination. Which position is being used? Option A, supine. Option B, prone. Option C, lithotomy. Option D, Fowler. The correct answer is option B, prone. Prone means lying on the abdomen with the face downward. Supine means lying on the back. Lithotomy involves legs in stirrups for certain pelvic procedures. Fowler is a seated or semi-seated position. Question 90. As part of exam preparation in a patient intake station, a blood specimen must be mixed with additive after collection. Which technique is appropriate? Option A, open the tube and stir with a swab. Option B, gently invert the tube the required number of times. Option C, leave the tube unmixed until pickup. Option D, shake the tube forcefully. The correct answer is option B, gently invert the tube the required number of times. Gentle inversion mixes blood with additive without causing unnecessary cell damage. Opening the tube can contaminate the specimen and expose staph. Failure to mix may cause clotting or poor specimen quality. Forceful shaking can cause hemolysis and inaccurate results. Question 91. While working in an electronic health record review, a patient must pay a percentage of the allowed charge after the deductible is met. Which term applies? Option A, remittance address. Option B, coinsurance. Option C, copayment. Option D, referral. The correct answer is option B, coinsurance. Coinsurance is the patient's percentage share of covered costs. A remittance address tells where payments or documents are sent. A copayment is usually a fixed amount rather than a percentage. A referral is permission or direction to see another provider. Question 92. After reviewing the situation in a medical office workflow, an insurance plan requires approval before a specialist visit. Which process is being described? Option A, autoclaving. Option B, auscultation. Option C, venipuncture. Option D, prior authorization or referral process. The correct answer is option D, prior authorization or referral process. Some plans require authorization or referral before certain services are covered. Autoclaving sterilizes instruments and is unrelated to payer approval. Auscultation is listening to body sounds and does not approve visits. Venipuncture is blood collection and does not authorize insurance coverage. Question 93. As part of exam preparation in a telephone triage workflow, a patient needs assistance transferring from a wheelchair to the exam table. Which action is safest? Option A, ask the patient to jump to the table. Option B, pull the patient by the arms quickly. Option C, leave the wheelchair unlocked for easier movement. Option D, lock the wheelchair and use proper body mechanics with assistance as needed. The correct answer is option D, lock the wheelchair and use proper body mechanics with assistance as needed. Locking equipment and using safe transfer technique reduces injury risk for the patient and staff. Jumping is unsafe and unrealistic for a transfer. Pulling can injure the patient and the assistant. An unlocked wheelchair can roll and cause a fall. Question 94. For a patient encounter in a busy front office, the assistant speaks with a patient who has hearing difficulty. Which approach is best? Option A, shout from another room. Option B, face the patient and speak clearly at a moderate pace. Option C, cover the mouth while speaking. Option D, assume the patient cannot participate. The correct answer is option B, face the patient and speak clearly at a moderate pace. Facing the patient supports lip reading and clear communication without shouting. Shouting from a distance reduces clarity and privacy. Covering the mouth removes visual cues. Hearing difficulty does not mean the patient cannot understand or decide. Question 95. Following office protocol in an outpatient laboratory, A patient has confirmed influenza and is coughing in the waiting room. Which infection control step is most appropriate? Option A, skip precautions if the patient is already taking medication. Option B, place the patient beside an immunocompromised patient. Option C, use only sterile gloves without a mask. Option D, apply droplet precautions and offer a mask according to protocol. The correct answer is option D. Apply droplet precautions and offer a mask according to protocol. Influenza is commonly managed with droplet precautions and source control measures. Treatment does not remove the need for appropriate precautions. Separating symptomatic patients helps reduce transmission risk. Sterile gloves do not protect mucous membranes from respiratory droplets. Question 96. A medical assistant is working in an administrative check-in area when the nervous system is being reviewed. Which structure carries impulses away from the cell body of a neuron? Option A, platelet. Option B, ureter. Option C, alveolus. Option D, axon. The correct answer is option D, axon. An axon carries nerve impulses away from the neuron cell body. A platelet is a blood component involved in clotting. A ureter carries urine from kidney to bladder. An alveolus is a lung air sac. Question 97. While working in a medication administration visit, a patient is placed lying flat on the back for an abdominal exam. Which position is being used? Option A, prone. Option B, Sims. Option C, Fowler. Option D, supine. The correct answer is option D, supine. Supine means lying on the back facing upward. Prone means lying face down. Sims position is side lying with one knee flexed. Fowler position is seated or semi-seated. Question 98. An office review in a procedure setup shows that the bladder of a blood pressure cuff is not centered over the brachial artery. Which issue may occur? Option A. The patient will automatically faint. Option B. The oral temperature will decrease. Option C. The pulse oximeter will stop working. Option D. The reading may be inaccurate. The correct answer is option D. The reading may be inaccurate. Proper cuff placement over the brachial artery is needed for accurate auscultation. Incorrect cuff placement can be uncomfortable but does not automatically cause syncope. Cuff placement does not change oral temperature. Blood pressure cuff alignment does not control the pulse oximeter. Question 99. As part of exam preparation in a women's health clinic, the assistant is comparing two needle gauges. Which statement is accurate? Option A. All injections use the same gauge. Option B. A smaller gauge number indicates a larger needle diameter. Option C. A larger gauge number always means a longer needle. Option D. Gauge has no relation to needle size. The correct answer is option B. A smaller gauge number indicates a larger needle diameter. Needle gauge numbers are inverse to diameter, so lower numbers are wider. Needle gauge varies by medication, route, and patient factors. Gauge describes diameter, not length. Gauge specifically describes needle diameter. Question 100. To protect safety in an outpatient laboratory, a patient with known latex allergy is scheduled for a procedure. Which preparation is best? Option A. Tell the patient to bring personal gloves only. Option B. Use powdered latex gloves because they are easier to put on. Option C. Ignore the allergy if the procedure is short. Option D. Use latex-free supplies and clearly communicate the allergy. The correct answer is option D. Use latex-free supplies and clearly communicate the allergy. Avoiding latex exposure prevents allergic reactions and keeps the team aware of the risk. The clinic remains responsible for preparing a safe care environment. Latex gloves can trigger a reaction in a latex allergic patient. Even brief latex exposure can cause a serious reaction.